I am Zamina from Cote d'Ivoire. The result of the study we are about to present to you are the fruit of the teamwork of my class from the second cohort of the field epidemiology training program intermediate level, FATP. The work is entitled Seroprevalence of COVID-19 among people aged 12 and over in a silent district case of Zoukougbeu, Ivory Coast, April 2023. The presentation plan is the classic plan from the introduction to the recommendation, including the objectives, methods, results, and discussion and conclusion. As an introduction, we can say that on March 11, 2020, Cote d'Ivoire reported its first confirmed case of 18-9. The same day, the World Health Organization declared the disease a global pandemic. As of March 31, 2023, a total of 39,454 confirmed cases and 290 deaths had been reported nationwide. However, the high frequency of asymptomatic infection and undiagnosed case makes it difficult and accurately estimate the true prevalence of COVID-19 in the population. In the Zoukougbeu Health District, only one suspected case had been recorded with later test negative. Given this context, it was necessary to conduct this study to assess the seroprevalence of COVID-19 and to better understand the extent of virus circulation in district without confirmed case. We set out ourselves the following objective for our study. The general objective was to estimate the seroprevalence of COVID-19 in people aged 12 years and older in Zoukougbeu. The objectives were the specific objectives were to describe the socio-demographic characteristics of respondents, assess the respondents' knowledge of COVID-19, identify respondent risk factors, evaluate the seroprevalent virus markers in the population. Our study setting in the Zoukougbeu Health District. Zoukougbeu is a locality in the central western part of Cote d'Ivoire. Located in the high Sassandra region, the town of Zoukougbeu serves as the administrative seat of the commune, the sub-prefecture, and the department. Its total population is 128,602. This was descriptive cross-sectional study that took place from April 16 to 27. The study population consisted of residents of the Zoukougbeu department. We include individuals aged 12 and over who had reside in this department for at least 6 months and who agree to participate in the survey free of charge and voluntarily. However, individual vaccinated against COVID-19 and individual with intellectual disabilities were not included in the study. Regarding sampling, we calculate the sample size using the Schwartz formula using EPI info. We obtain 400 people, taking it into account a 20% non-response rate. A three-stage cluster sampling design was adopted. In the first stage, clusters were selected. In the second, households, and finally, individuals. The number of individuals to be surveyed was obtained by dividing the sample size by the number of clusters selected. Cluster selection was done using probability proportional to size sampling. Data were collected interviewing investigators face-to-face using a paper questionnaire. Blood samples were taken from each investigator and placed in tube to be sent in a tripack to the reference laboratory at the Pasteur Institute in Cote d'Ivoire. The study variables include socio-demographic variables, clinical variables, knowledge about COVID-19, and laboratory results, positive or negative EGG and EGM. The data were entered into EPI info, and Excel was used to present the results in tables and graphs. Measure of central tendency were calculated for quantitative variable, and the frequency or proportion were calculated for qualitative variables. Laboratory procedure. The sample was analyzed using PCR tests. We first conduct a pre-survey on April 17 in the neighboring health district at Zoukougbeu in order to control for any potential bias in the study and to properly design the questionnaire. We then conducted the actual survey in 4 sub-prefectures of the department of Zoukougbeu from April 18 to 27. Ethical considerations were observed. Respondents were divided according to the size of the population in each sub-prefecture. Thus, we surveyed 50 we surveyed 50 50, 27, 16, and 7% in Zoukougbeu, Gregbe, Gesabo, and Domangbe, respectively. We will now present the results section of our study. We will begin with the chapter on the socio-demographic characteristics of the respondent. Regarding age, the age group from 18 to 49 were more represented in the study, accounting for 65.83%. The median age was 22 years, range 12 to 101. Regarding gender, women were more represented in the study, accounting for 54% respondent. Indeed, most women are housewives. Thus, they are the ones found at home. The majority of men work either in office or in field. It is therefore women who are most often present at home during household surveys. Regarding level of education, respondents from secondary and primary schools were more represented in our study with 36.9% and 32.70% respectively. During epidemic, information circulates in a blurred fashion, and you need to have the discernment to read document or listen to useful information to avoid contamination. The primary level is not too reassuring for understanding certain written document. In terms of knowledge about COVID-19, we asked the respondents if they had any information or had heard about the disease. The majority, 97% of those surveyed had information about COVID. Having information about the disease can help you take precaution to avoid it. Respondents had various sources of information about COVID-19. The main sources of information were television, 67%, followed by radio, 54.4%, and information heard from friend and family, 45.22%. All sources of information about COVID-19 during the pandemic were good as long as they relayed important information from the government or organization like the WHO. When it came to knowledge of the science of COVID COVID-19, the majority, 54% of respondents, said they were unaware of the signs. Excuse me. This information given by the respondents is worrying, especially as knowing the disease means knowing the science, not knowing the science of COVID-19 means that these ignorant people will spread the disease among the population, although they won't respect barrier measures. When asked about their knowledge of the severity of COVID-19, the majority, 89% of respondents, said they knew that COVID was a serious illness. This knowledge about the severity of COVID by several investigators should allow them to adopt hygiene measures and get vaccinated against COVID-19 in order to avoid this disease. The majority of respondents, 79%, believe that vaccination was a means of protection against the disease. This response from the majority of the interviewers is a salutary one, especially as it is thanks to vaccination, which is a safe means of protection against transmissible disease such as COVID-19, but the population can be saved. The majority, 76.4% of respondents, said they did not have any chronic disease. However, 3.80% of respondents had hypertension, followed by 2.26% with asthma, 0.50% with heart disease, and 0.25% with diabetes, tuberculosis, and HIV, respectively. In fact, that many of the respondents had assumed that they had no chronic illness, then could prevent cascading death linked to COVID-19. A number of studies had indicated that chronic disease were comorbidities of COVID-19, notably diabetes, respiratory disease. The majority, 69 of respondents, said they had traveled outside the department of Zoukougbeu during the COVID-19 period. During the COVID-19 pandemic, restrictive measures, including a travel ban, were imposed by the government. Also, the department neighboring Zoukougbeu and several departments in Cote d'Ivoire had reported at least one case of COVID-19. Thus, all those who traveled were likely potential suspect case. These people would spread the disease to the population upon their return to Zoukougbeu. According to serological analysis, 99.23% have responded. According to serological analysis, 99.23% respondents had IgG antibodies and 6.28 had IgM positive antibody. It is important to note that all those surveyed had been in contact with COVID-19. In the event of a pandemic or communicable disease epidemic, no one is protected if measures prohibiting gathering or public transport travel are not respected, and above all, if vaccination is not adopted. Cases of COVID-19 are represented as dot, and the incidence of COVID-19 as a range. All sub-prefectures were affected by COVID-19. We count more confirmed cases of COVID-19 in the sub-prefecture of Zoukougbeu. However, the sub-prefecture of Zoukougbeu was the most affected area. In conclusion, evidence of COVID-19 infection was detected in the Zoukougbeu department. The prevalence of COVID-19 was found to be high, as all individuals surveyed tested positive for exposure. The population demonstrated a presumed high level of knowledge regarding COVID-19 and its prevention measures. A significant proportion of participation reported having no chronic medical condition. Frequent travel outside the Zoukougbeu area was also among respondents. Recommendation to the Department of Health for Directorate Zoukougbeu. Strengthen epidemiological surveillance, reinforce community awareness and sensibilization activities on COVID-19. To the Departmental Health Directorate of Zoukougbeu. Strengthen epidemiological surveillance, reinforce repetition, to the Region Health Directorate of Haute Saint-Sandra. Provide technical support to the Department Health Directorate at the central level, ensure the provision of adequate financial and material resources. We would like to apologize for our accent. Thank you for your attention.